So a neurotologist is a board certified specialist who starts out by doing medical school after college and then doing a full ENT or otolaryngology residency. Once you complete the 5 to 6 year ENT residency, you take a board to become a board certified otolaryngologist. A neurotologist is someone who has gone on and done an additional 2-year fellowship specifically studying the whole structure of hearing in the brainstem. So a ENT doctor is going to be very focused in this area. So the ear canal, the middle ear, even doing things like cochlear implants. That does not require a board certification in neurotology. Neurotology is when we start moving up into the intracranial cavity and we start operating inside the layer of dura that houses the brain. The neurotologist is somebody who actually is working in collaboration with neurosurgeons and working on conditions really focused in an area that we call the cerebellopontine angle. So your spinal cord comes up through what we call the foramen magnum in your brain into the posterior fossa of the brain. A neurotologist really focuses in collaboration with neurosurgeons in the posterior fossa and in the middle fossa of the skull. This is what we call the skull base, or where we do skull base surgery. When you take the brain out of the bone, we see this is the spinal cord that comes up through that foramen magnum. And the first thing we see in the posterior fossa is the cerebellum. And going up into the middle fossa, we see the temporal lobes. The temporal lobes are very important for speech, for producing your language. And my fellowship and the fellowship of everybody who's a neurotologist focuses on this 2.5 centimeters of tissue here, where you have all 12 cranial nerves. They take care of moving your tongue, swallowing, sensing your throat, balance, hearing, facial movement. And then you go a little higher, you get the sensation that you get in your face and in your scalp. And then we have the nerves that move your eyeballs and the nerves that give you olfaction or smell and vision. So my fellowship is really focused in that posterior and middle fossa area around the nerves, mainly focusing on movement of your eyeballs in the socket through hearing, speech, balance, and swallowing and moving your shoulder and tongue. Those are the areas where we spend most of our time operating. So a neurotologist actually requires a second board certification in neurotology. So it's a double board certified specialist who is an expert beyond what they've learned through their ENT residency. Again, an otolaryngologist or an ENT surgeon can do all different types of ear surgery. They are board certified to do that. But the people that are actually going into the skull area or doing the more complex operations would typically be a neurotologist.